Hello, good afternoon. Welcome and thanks so much for being here to discuss broadening the movement, housing as a national priority in 2020. I'm Diane Yantel. I'm President and CEO of the National Low-Income Housing Coalition. We are a membership organization that's dedicated to achieving socially just public policy that ensures that the lowest income people have decent, accessible, and affordable homes. And I'm here today as part of the Opportunity Starts at Home campaign, which is an unprecedented multi-sector campaign with leaders from many fields working towards increased investments to house the lowest income people. And we're here because 2020 is such a consequential year for our work. We have, at the same time, these tremendous threats and challenges and opportunities. And in many ways, I think the threats and the challenges are obvious. The housing crisis is worsening. Homelessness in many communities is increasing and becoming increasingly visible. The harm of both is disproportionately impacting people of color. The lowest income people, people of color, people with disabilities, immigrants, and others are increasingly under threat by actions by this administration, and as are the programs that keep some of the lowest income people affordably housed. At the same time, we have tremendous opportunities. We have a growing movement of people working towards solutions to the housing crisis. We have an increased awareness of the intersectionality of housing with so many other sectors. We have increased public awareness of the problems and the solutions. We have presidential candidates talking about the housing crisis and its solutions to an unprecedented degree. 15 presidential candidates have put forward proposals or plans to end the housing crisis. And we have increased urgency on the Hill. For the increased movement, the Opportunity Starts at Home is central to that. And the campaign is co-led by the National Low-Income Housing Coalition, the National Alliance to End Homelessness, Center on Budget and Policy Priorities, and Children's Health Watch. And it is guided by a steering committee of powerful leaders in many other sectors, including the healthcare sector, the education sector, the civil rights community, anti-poverty, anti-hunger communities, the faith-based communities, and more. And you'll hear from many of these leaders today. The campaign came together with an understanding, one, that despite the very best efforts of many of us in the housing field, the crisis is getting worse, and we can't keep doing the same things we've always done. We have to do things differently. Also, that we benefit from a growing understanding and a growing body of research of how central housing affordability is to so many other areas of our lives. Right? We know that when we're affordably housed, we are healthier. Our kids do better in school. We earn more over our lifetimes, and we even live longer, depending on the community we live in. So we took this research and this understanding that leaders in all of these sectors, including in the housing sector, none of us can be successful in reaching our goals of better health or better educational attainment and so on until more people are affordably housed, that we decided to work together towards increased federal investments in the solution that keep the lowest income people affordably housed. And we certainly have our work cut out for us. The housing crisis is severe. Nationally, there is a shortage of 7 million homes affordable and available to the lowest income people. So another way of saying that same number is for every 100 of the lowest income renters, families, people with disabilities, families with children and others, there are just 37 homes that are affordable and available to them. And you can see from the map that the shortage and the crisis is pervasive. It's impacting rural, urban, and suburban communities, And it ranges, the shortage and the crisis itself ranges from most severe to least severe. But there is no state that has a sufficient number of homes affordable to its lowest income renters. Another way of looking at the crisis is by examining wages and how they are keeping up or not with rent. So a piece of research that the National Low-Income Housing Coalition puts out each year is called Out of Reach, and that's where we come up with what we call the housing wage. So this is how much you have to earn an hour just to be able to afford to rent a modest apartment. And nationally, the housing wage for a two-bedroom apartment is nearly $23 an hour. And you have to earn nearly $19 an hour to afford a one-bedroom apartment. So clearly, these rents are out of reach for minimum wage workers and also for the average renter, whose wages are about $5 less than what they need to earn to afford a two-bedroom apartment and about $1 less an hour than what they have to earn to afford a one-bedroom apartment. So this challenge will be one for the foreseeable future. The Department of Labor projects the jobs that are expected to have the greatest growth over the next 10 years, and 7 out of 10 of those jobs pay less than what one must earn to afford a one-bedroom apartment. So as a result of this shortage of homes affordable for lowest-income people and this gap between what people earn and what rent costs, we have nearly 8 million of the lowest-income renters who are paying at least half of their income towards rent. They're severely cost-burdened. And many are paying much more. They're paying 50, 60, 70% of their income just to keep a roof over their heads. And you can imagine when you have such limited income to begin with, and you're paying more than half of it for your home, you have very little left over for all of life's other necessities. And you are one financial emergency, a broken down car, a missed day of work, a sick child, away from not being able to pay the rent, facing eviction, possible homelessness, and a spiraling down deeper into poverty that results. It's important to recognize that the housing crisis does disproportionate harm to people of color. Housing justice and racial justice are inextricably linked. The majority, as you can see on this chart, the majority of extremely low-income, severely cost-burdened renters are people of color. And this is the result of years, decades, centuries of systemic racism and discrimination. So this shortage of homes, this gap between earnings and cost of rent, this is why we have homelessness in our country. It's why we have housing poverty. We have homelessness and housing poverty because we have a system in our country where only 1 in every 4 households who are eligible for and in need of housing assistance receives any. So 75%, 3 out of 4 people who need housing assistance gets none. They're the folks who are waiting in line to add their names to years, sometimes decades-long waiting lists, hoping to win what's essentially a housing lottery in our country, where only the lucky 25% gets the help that they need. So the good news is that we can solve this. We can choose to solve and end homelessness and housing poverty in our country. We know what to do. We have the solutions, and certainly as a country, we have the resources. We only lack the political will to fund the solutions at the scale necessary to solve the crisis. And these are the solutions. This is the policy agenda for the Opportunity Starts at Home. And you have in your handouts more details about this policy agenda. But it's about political will. And the political will is growing. We commissioned a public poll early last year, and the results were very clear that the majority of people want to see action. 85% of the public believes that a safe, decent, affordable place to live should be a top national priority. And 8 in 10 people in the United States, and this is across party lines, this is from conservative to progressive, 8 in 10 people in America believe that the President and Congress must take major action to make homes affordable to low-income households. So the overwhelming support for these solutions is clear, as is the extraordinary need. And we have to keep in mind how expensive inaction is. Right? We're paying every day to maintain homelessness and housing poverty in our country, and we pay for it through increased health care costs, through lowered educational attainments, less taxes paid over individuals' lifetimes, and so on. So we must instead invest in solutions at the scale necessary. So we have today with us a tremendous group of experts and leaders in a number of fields who are here to talk with you today about why they believe it's so important for housing to be a top priority in 2020 and what brings them to this work. So I'm going to turn it over to Mike Kropowski, who is the National Campaign Director for the Opportunity Starts at Home campaign, to introduce our panel. Thank you.
Thank you. Thank you, Diane, and good afternoon, everybody. Thanks for coming on out to this event. As Diane said, I'm Mike Kropowski. I'm the National Director of the campaign. We have a rock star panel for you today. They each bring an enormous amount of experience and really unique perspective on this conversation about housing. So before I introduce the panelists, I'll just mention that we originally planned for Deanna Hoskins from Just Leadership USA to be here as well, but unfortunately she got stuck in New York City this morning, so she sends her apologies for not being able to make it. And then also I want to mention that Clarence Anthony, who we were also expecting, had a family emergency last night and couldn't make it, so we send our best wishes to Clarence, and he, of course, sends his apologies. But in Clarence's place, we have the dynamic Irma Esparza Diggs. She is the Senior Executive and Director of Federal Advocacy at the National League of Cities, the nation's oldest and most representative association of municipal governments. Most recently, she served as Chief of Staff in the Office of Legislation and Congressional Affairs at the Department of Education under both Secretaries Arne Duncan and John King. And prior to joining the Obama administration, she led the House Democratic Caucus as Executive Director, and she's also served as D.C. City Council Chief of Staff. Next to her, we have Fatima Goss-Graves. She's the president and CEO of the National Women's Law Center. And the center, of course, fights for gender justice in the courts, in public policy, and in society at large. Fatima has served in a number of roles at the center for more than a decade. She's among the co-founders of the Time's Up Legal Defense Fund and is widely recognized for her effectiveness in the legal and policy arenas at both the state and federal levels. Then we have Sister Donna Markham. She is the president and CEO of Catholic Charities USA, and she is the first woman to hold this position in the organization's over 100-year history, which is awesome. She is a Dominican sister with a doctorate in clinical psychology. She served on Catholic Charities' Board of Trustees for 8 years, 2 of which she was the board chair. And then prior coming to Catholic Charities, she served as president of the Behavioral Health Institute at Mercy Health System, and she's also engaged in an array of global peace initiatives through various conflict zones. And then last, and certainly not least, we have Dr. Megan Sandel. She's a practicing pediatrician, principal investigator with Children's Health Watch, and co-director of the GROW Clinic at Boston Medical Center. Children's Health Watch, they're a network of pediatricians and public health researchers and policy experts that's really committed to improving child health in America. Megan is a nationally recognized expert on the connection between health and housing, particularly for kids. She's written and published numerous peer-reviewed scientific articles and papers on this subject. And as Diane said, Megan and Children's Health Watch were a founding partner of this campaign. So let's give a round of applause to our panelists for coming out today. Thank you all. So let's start. Let's do a question for everybody here. Your organizations, as we saw in the bios, really represent a range of different sectors, and there's a range of priority issues within each of your organizations. So I'm hoping you could spend just a minute or two talking about your organization's mission and why your organization decided to join the steering committee of the Opportunity Starts at Home campaign. So why don't we'll go in order. We'll start with Irma.
Yes. First of all, thank you,
Mike
and Diane, for the opportunity to be here and have this conversation, which is so important and has been important and a long time coming. Let me just say that mayors and city council members are on the front line every day dealing with this issue. And the reality is that even though housing may not have been a central part of their platform when they ran for office, they feel it is their responsibility to address it. And their residents are looking to them to address it. So as the National League of Cities, our job and my job is to ensure that cities have the resources that they need, can share best practices amongst each other about what's working, but also have a conversation about what is our responsibility in addressing this, bring them together, and frankly, fight at the federal level for additional and increased federal investment. That is our job, our responsibility, but the reality is we can't do it alone. It is all of the stakeholders have to be at the table, which is why coalitions like this are so important. And it's not people every day who do housing, but people who are impacted when we don't have a solid housing game plan for each community, whether it be large, small, led by a Republican or a Democrat or an independent. This is not a blue city versus red city issue. This is an issue that affects everybody. And the reality is that Diane mentioned close to 8 million people are spending more than half of their incomes on housing. When a family is spending more than that on their housing, there are other things that are not getting covered. Child care, health care, groceries, quality foods. That impacts our quality of life. So for us, this is not just a priority, it is a calling because it is what city leaders need right now.
Thank you. Fatima.
Hi to everyone. I'm so happy to be with you today, and thank you to both of you. You know, the National Women's Law Center was founded in 1972, so almost 50 years ago, and our work takes us to the courts. We work to pass new laws and policies, and we engage in meaningful culture campaigns. And all of that work is thinking about how to improve the lives of women and girls and ensuring that that they are able to live and work and learn with safety and dignity and equity. And when we think about what that means, we think about what does it mean for that to be true for brown and black women? What does that mean for that to be true for women with disabilities? What does that mean for that to be true for those who are in the LGBTQ community or all of those who cross each of those identities? And when you think about the work of the campaign, it is deeply connected to all of the other work that the National Women's Law Center also does. Our work on women at work, both their wages and their quality of jobs. Our work to ensure that people have access to health care and the health care they want and the health care they need. Our work to ensure that people have access to schools and can be treated safely in schools. The work that we do so deeply with the Me Too movement, more broadly around safety across institutions, right? And that includes being safe in your home. So all of those things are so deeply connected. Whether or not you can access and afford childcare is very deeply connected to your ability to be housed and have stability. So we are really thrilled to be a part of this campaign. I really also want to acknowledge my colleagues at the National Women's Law Center who are really grappling with how do we meaningfully participate in this question because it is so central to women's lives. My colleague Melissa Boteach is here, but really there was an insurgent movement at the Law Center to say it's so critical for us to be out there and full-throated in this moment for all of the many reasons that you named in your presentation.
Thank you, Fatima. Sister Donna?
Well, thank you so much. I'm just thrilled that Catholic Charities can be part of this as well. We're proud to be part of it. It cuts deep into the heart of our mission. A little bit about Catholic Charities, just so you know who we are. We're the domestic humanitarian work of the Catholic Church in the United States and the territories. And every year we serve about 12.5 million vulnerable people. We provide about $4.5 billion in services to people in need each year. And that's regardless of their faith tradition, their creed, whatever. It's people who really need us. So for us, it's if you need a place to sleep, we're going to help you find it. If you need some food, we're going to help you get it. If you are a newcomer to our country, regardless of your status, we're there to help you. It's a real privilege, I think, for us to enter into the space of that kind of vulnerability and stand in solidarity with people who are struggling. So as we were analyzing at Catholic Charities some of the critical needs that are facing people, we actually engaged in a process that of a theological reflection with about 58,000 employees across the country to ask them to read the parable of the Good Samaritan and ask who's lying by the side of the road today that nobody wants to take care of. And from that reflection, we learned a whole lot that really shaped our work in the coming years and helped us to develop different aspects of our work in a more deliberative way. Housing arose in every single Catholic Charities agency, in every single state and in every territory of the country. That jolted us into a real change in terms of how we organized our national office, how we looked at our work in food security, how we looked at a myriad of other issues, how we do jobs training, et cetera, et cetera. So that need was so compelling that we had to really move into full throttle uptick. We have been operating over 35,000 units of housing of all types when I came into this job 5 years ago. But now we've really felt the imperative to ramp that up significantly. And we're doing that, and I'll say more about that later today, but in close relationship with our health partners and with other organizations that are committed and are mission aligned with us. So that's really why I would have to say we are so delighted to be part of OSAH because we find other people that we can connect with and really stand together in poverty reduction and health promotion as housing serves as a key to those issues. So thanks a million for having me and us.
Thanks for having us. Megan.
Great. Well, I'm going to join in thanking my panel. It's really a privilege to be today with you and being able to talk about this subject that's really passion for me over the last 20 years. For those that don't know Children's Health Watch, as Mike alluded to, it's a research policy network that's been around for 20 years. And our mission is to improve the health and development of young children and families by looking at the public policies that influence hardships, common ones like food insecurity, housing instability, energy insecurity, healthcare cost trade-offs. And what we have done over our 20 years is interviewed 70,000 families in 5 cities, in Boston, Baltimore, Philadelphia, Little Rock, and Minneapolis. And what our research says over and over is that a stable, decent, affordable home is a prescription for good health. And what we know is that that's not just about not being homeless. That's about not having to move frequently and not falling behind on rent. that really is where we're going to see the biggest health impacts over a lifetime. I also am a pediatrician. I still see patients at Boston Medical Center. I co-direct the GROW Clinic, which is for kids with failure to thrive. And what I'll tell you over and over again is I can give the most expensive medications. I can order the most expensive tests. And over, the thing that gets kids to grow is an affordable home. And so as we think about it, why Children's Health Watch has joined the Opportunity Starts at Home coalition is because that pharmacy of prescriptions for affordable homes is empty for 3 out of 4 Americans right now. And the only way we're going to fill it is by talking to the president and Congress about what it's going to take to be able to fill that for everyone.
Thank you, Megan. I think we certainly have already identified a theme for today, which is that housing is inextricably linked to nearly every measure of having a quality life. And I was reflecting on what Irma was talking about, though. This isn't blue, this isn't red. This is clearly a purple issue. It's impacting places across the country. And we're starting, that awareness that exists at the city and state level is certainly bubbling up to the federal level as well. And we're seeing bold, ambitious housing legislation in Congress at a pace that we've never seen, at least in recent memory. And many of those bold pieces of legislation are bipartisan legislation as well. In fact, last month, we saw 2 major pieces of bipartisan legislation introduced in the Senate, the Eviction Crisis Act and the Family Stability and Opportunity Vouchers Act. And the campaign has endorsed those, and we're actively championing them. So there's a lot of reasons to be optimistic going forward. Irma, I wanted to now sort of target some individual questions. Diane mentioned this throughout her presentation of just how dire the situation is and the racial disparities of the crisis. And it's critically important for all of us to say that the crisis we're in today did not happen by accident. It is the consequence of failures in public policy over many decades, whether it's federal disinvestment in housing programs or explicit racial segregation for decades upon decades, the intentional placement of affordable housing in neighborhoods of concentrated poverty with the least opportunity. So, Irma, I'm hoping you can talk about what you've seen in cities across the country and your view on what it will take to achieve racial equity.
Oh, tough question.
Big question. Yeah. We don't throw softballs around here.
No, not at all. But I appreciate it because the reality is that we are living with the consequences of historic and oftentimes intentional discriminatory housing policies like redlining and racialized zoning. And frankly, if you don't do this work and you aren't a student of how we got here, you don't even realize the decades of public policy that has been intentional about segregating communities. And unfortunately, our city leaders who are coming in office or in office today are the ones being tasked with the challenge of addressing that through public policies now. And also, I'll just be honest about it. There are some communities that don't realize how much, and some leaders, how much they need to be proactive and have an open dialogue of why their communities look like they look today. And frankly, further segregation continues across the board. And so housing segregation has been costly to American cities and frankly destructive, which I think is why it's so easy for our president to point fingers and make mockeries of big cities who are frankly, like Los Angeles and San Francisco and Oakland, who are struggling to address the housing challenges. And you know, I will say just earlier this week, there's an NPR story about the Moms for Housing who have occupied a home, and there was an image of Mayor Libby Schaaf with one of the moms, and they have occupied this home to basically say housing is a basic right. My heart broke for both of them because the reality is that these mothers had to take a make drastic decision and a drastic action in order to convey how difficult it is for them to obtain housing for them and their children. And it's what families are dealing with every day. And even though the mayor in the city of Oakland has been intentional about coming up with a plan to build 10,000 affordable housing units in communities that are being gentrified, that's gonna take place over 10 years. It's not gonna happen overnight. And so that's the challenge, right? How do you deal with decades of segregationist public policies as it relates to housing and make change overnight so people don't have to worry about where they lay their heads? And just because you move encampments doesn't mean that housing is gonna go away. But I'm proud that you have city leaders who are taking an inventory, looking at their own policies, setting goals, building it into their comprehensive plans, and giving the directive to all of their cabinet and directors to say, we are going to make this right. Now the challenge is the communities, right, that don't want affordable housing in their community. That's not a public policy issue, that is a people issue, and the politics of that are sometimes way more difficult in having that conversation, or way more difficult that it makes the conversation a non-starter. Well, I'm thankful that because of the work that all of us are doing, that frankly we're able to address this and figure it out by working with one another, and frankly don't let us off the hook. Local government, state government, federal government, private stakeholders, private companies, developers, we all have a responsibility to figure this out.
Thank you. Yeah, a number that is burned into my mind is the national statistic that 1 in 4 black households live in a neighborhood of concentrated poverty. So 1 in 4 black households, 1 in 6 Hispanic households, 1 in 13 white households. Those are the types of yawning disparities that could not have happened by accident, right? Those are the types of disparities that could only have been engineered through bad public policy, and it's something that can only be fixed through good public policy. So thank you for that, Irma. Fatima, I want to turn it over to you. You know, the National Women's Law Center is the newest addition to the steering committee. Diane and I met with you just a few months ago, and you weren't that hard of a sell. You sort of got the connection. That gender equity in this country demands access to safe, decent, affordable housing. You already sort of alluded to this, but I'm wondering if you could dig a little bit deeper into that connection for us.
Yeah, and I'm going to put a few numbers on the table to ground us further, and really to ground why maybe you invited us, maybe we begged. I don't know how, I don't know how exactly it went, but you know, when you think about the wage gap in this country that has not moved very much, what it means in practice is for Latinx women, they lose over $1 million over the course of their career. What it means for black women, it means that they lose out just under $1 million over the course of their career. So those, you know, that is a difference between having one sort of life and having another sort of life right there. When we look at who is concentrated, I was really loving all of the statistics about the amount you need to make per hour versus the amount you need to make per hour to afford a 1-bedroom. And what we know is that women make up the vast majority of minimum wage earners, which in many states in this country is still $7.25, and they make up the vast majority of tipped workers who, except in the 7 states where there is one fair wage, are largely relying on tips to get them up to at least that $7.25, right? And when you add in things like wage theft and more, many make less than that. And so those basic income pieces that are systemic, in which women of color are bearing a disproportionate share of, are not new ideas. They may seem intractable, but here's what I'm going to tell you that I'm excited about. Irma, I'm so glad you said, don't let us off the hook. Because I do not think we are in a moment where people are about letting anyone off the hook. And I think the activism that you have seen that has been largely led by women across this country, you've seen it show up on questions of equal pay, you've seen it show up on questions of sexual violence, you've seen it show up on questions of reproductive health care, you saw it dramatically in the streets yesterday when Virginia became the 38th state on the ERA. These are not disconnected ideas, guys. This is one movement that is really suggesting that we are done. That whole time's up thing was actually a very convenient phrase. We are done with the usual ways of doing business. And some of that will sometimes look like the direct action that the mamas in Oakland took. I'm from Oakland, I grew up there, and when I think about the transition that has happened over the last decade, it is appalling. When I go back and see the rows and rows of camps and a plan that has come far too late to meet the need, it is so, so appalling. I asked my colleagues, because after I saw that NPR piece, I said, well, can you tell me, what is the number of vacant housing units in this country versus homeless population? Because I had heard a number and I said, surely that is wrong. But the number that apparently the Federal Reserve Bank of St. Louis said was that there's 17 million vacant housing units in the United States in 2018. Meanwhile, 552,830 people were experiencing homelessness. I'm sorry, it is stunning to me. And it is stunning that they had to demonstrate that that home had been vacant for 2 years before they moved in and tried to fix it up. So anyway, I guess what I would say is that a lot of this, there is a cultural element. The longtime stigmatization of especially brown and black women shows up in our public policies. And what I would suggest is that we are in an unprecedented moment where people are finally seeing and hearing what people have been screaming out for so long, and that is that there is a deep need to be treated with dignity, and housing is at the core of that.
Thank you, Fatima. That was powerful. Sister Donna, I want to ask you, this is a good segue from what Fatima was talking about. There are many ways to talk about why we should invest in affordable housing. We can talk about health outcomes. We can talk about education outcomes. We can talk about economic growth. But there's also, of course, the moral case. The U.S. Conference of Bishops says, quote, "A basic moral test is how our vulnerable members are faring. In a society marred by deepening divisions between rich and poor, our tradition instructs us to put the needs of the poor and vulnerable first." So when we take that principle and we apply it to housing policy, how is our nation doing against this basic moral test?
Pitifully, to put it in a word, because, I mean, it is a moral imperative. Those of us that purport to be people of faith, we could say, well, as a faith-based organization, assisting vulnerable people claim a life of dignity is not just another part of our work. It's not just another part. It is a moral imperative. Now, trying to convince other faith-based friends in my own denomination and others of the truth of that and counteract NIMBYism is a whole other matter, as you all know. So, I want to use my Irish heritage to instill a lot of guilt. So, we know that our longstanding Catholic social teaching says that we are obligated to make a preferential option for those who are poor and vulnerable. And we've got a crisis on our hands. And what are we doing about it? And I want to say that to brothers and sisters of faith, whatever it is, whatever denomination. The option for the poor was strikingly demonstrated to us Americans back in 2015 when Pope Francis came to the city. And right after he addressed Congress, he walked over to the Capitol to have lunch with 300 homeless folks at Catholic Charities. And during that luncheon, he said, "Let me be perfectly clear. There is no social or moral justification whatsoever for the lack of housing." And he said that to those 300 folks that were sitting there and to the rest of us. So, you know, he's speaking that. His words galvanized us to say, we've got to figure out how to get at some creative, evidence-based solutions to this mess that we've created in our country. Huge disparity. The tent cities and everything else we've all seen, it is shocking, and it, frankly, I think is scandalous for us. So what I'd like to do is, there's a 90-second video I'm going to share with you that is a description of one initiative that we're undertaking on behalf of the chronically homeless crowd, the people that everybody says they're so hard to house, you're going to be a failure at it. We don't believe that. We're already seeing results from it. So I'd like to just share this 90-second video, and it's really trying to galvanize. What we're trying to do is galvanize our faith community, and you'll see that in the video. So could we play that?
Yes.
These are the faces of the chronically homeless in our community. At Catholic Charities, we believe that every human being is made in the image and likeness of God. Every person deserves a place to call home. Chronic homelessness is both a cause and a result of poverty and of poor health. We can't guarantee an end to chronic homelessness, but we will never stop offering the solution. Our solution means that everyone has a pathway to permanent, supportive, and healthy housing. The largest provider of housing and social services in the U.S., other than the state itself, is Catholic Charities. The largest provider of medical services in the U.S., other than the state itself, is Catholic Healthcare. Imagine what would happen if they joined together to address the problem of chronic homelessness. Catholic Charities USA's Healthy Housing Initiative seeks to do just that. By developing surplus church property and new construction into affordable housing and partnering with healthcare providers to provide comprehensive care through wraparound services, we believe we can accomplish our three main goals by the end of 2026. To reduce chronic homelessness by 20% in 31 cities, lowering hospital readmission rates by 25% in those cities, and connecting 35% of those housed with primary and behavioral health care. That's our solution to solving chronic homelessness in the U.S.
So, seeing that, you can see what we're trying. We're aligning Catholic healthcare systems with Catholic Charities agencies that are invested in housing, and we're also tapping in to the bishops and the pastors who have surplus property in core cities and rural areas that they're not using. They're just lying there vacant, and figuring out how we're going to develop that into permanent supportive housing. That's, in many cases, it's not just the permanent supportive housing for the chronically homeless, but also mixed housing for affordable housing. So we are in the process of that in 5 pilot cities right now: Spokane, Washington, Portland, Oregon, St. Louis, Detroit, and Las Vegas. Yeah. So each of those cities has its unique challenges, and but for us, we have, in those 5 pilot cities, we have, our target is to get 700 of those. There are 700 chronically homeless people that are the 20%. Get those folks housed, and we're gathering our data now. Then we're going to broaden this out to 31 more cities across the country where there is a bishop who's willing to let us use property. There's a Catholic health system that's invested, that's mission aligned with us and willing to assist us with both pre-development loan funding, community benefit funding, in some cases treasury impact investing, and get the thing moving. So it's very ambitious. I can tell you it's working. In Spokane, the health system in Spokane has saved nearly $18 million by addressing this issue and getting 350 people housed in safe housing with wraparound services. So it is possible. We're going to start with, with our natural mission-aligned folks, and then develop the model more, get that out there so anybody can pick it up and do it. So I think we don't do it alone. We do it with wonderful partners. Enterprise community partners have been a big supporter with us, a lot of banking folks. We've got impact investors that are part of it, as well as the organized institutions in those areas. So finally, I think that we need to acknowledge, sadly, that we've not done all that we could to meet the basic moral test of attending to the needs of poor people and their children, to live safely and securely in a home and have a pathway out of extreme poverty. So, but I have a feeling that maybe together all of us can do that. So thanks.
Thank you, Sister Donna. That is talking about healthy housing is a perfect, it's almost as if we designed it this way.
Yeah.
Megan, so of course, as I mentioned, you're a national leader in highlighting that housing instability and homelessness balloons healthcare costs across our country. It's linked with adverse health outcomes across the lifespan. So talk about your experiences as a practicing pediatrician and as a researcher as well.
Yeah, thank you. And it really, Sister Donna, you couldn't have set me up better. And in many ways, right, I think healthcare more and more is acknowledging what we are calling the social determinants of health, right? And I will sometimes joke, we're late to the party, right? It's not that social factors, it's new that they're driving healthcare costs, but I think our appreciation of them is relatively new. And I think that as we understand it, I think that nothing really makes the case better for how a social factor drives healthcare costs than being homeless or housing unstable. That the face validity of that and how we see that, and honestly really predicting your health from where you live becomes really essential. There's a really great phrase the Robert Wood Johnson Foundation uses, which is that your zip code may be more important to your health than your genetic code. And what it recognizes more and more is that really great health care probably only predicts to say 20% of your actual health outcomes. That actually your genetic code may only predict to 20% of your health outcomes. And the other 60% is tied to where you live, whether or not you live in a stable home, whether or not you have a grocery store with healthy foods or a place to exercise or you feel safe. And so more and more as we think about that, we as healthcare need to start thinking of ourselves as anchor institutions in our community. That how we do our person-based care also needs to be influenced by how we do place-based care. And so that what you're seeing now more and more, and really the Catholic health systems have led the way on this, Bon Secours Mercy, Dignity, now known as Common Spirit, have invested over decades in creating more affordable housing options. And what you're seeing now is that anchor institutions are joining together into a national network. The Democracy Collaborative has convened over 45 healthcare systems, where we are, 14 of us have committed together $700 million towards investing in community development. Last February, we did a Housing is Health Policy Day because we need to bring our voices to the conversation about how to change healthcare. And then we're doing another day in March 12th because we need to be able to build momentum to be able to really push the envelope about what are the principles about housing is health and what we'd like to see from policymakers, because we have been absent from this and we have really not done what we could do before. Now we are going to show up, but we also want to partner. We want to partner with our housing partners, and we want to partner with policymakers in order to make this a reality. I'll just end with this idea that as we talk about where are we going to find the money for that, I just want to echo what Diane said earlier. We spend a lot of money right now on what is really bad outcomes. And so we at Children's Health Watch did a research paper in pediatrics in February of 2018, where we looked at 20,000 interviews of low-income renter families, and we asked them about their housing status. And we had kind of 3 shocking things. One was that 1 in 3 of the renter families we interviewed had a form of housing instability. Either they were homeless, moving frequently, or behind on rent. The second thing that was shocking to us is we knew that homelessness would be part of it, but we were interested to see, was there overlap between the housing unstable group and the behind on rent group? And no, these are distinct groups of people. So as we talk about ending homelessness, we also need to understand that that will only be a pocket of the people affected, that there's a lot of people who are hidden homeless that we need to be able to talk about as well. The third thing that was really shocking was we knew that homelessness would be associated with adverse health in kids, adverse health in their parents, associated with food insecurity and energy insecurity and other trade-offs they were making. But when we stacked up those adjusted odds ratios, the families that were behind on rent looked just as bad as the homeless families. And so we have to be able to do that. So we actually did a Congressional Budget Office estimate of what would it take for every family who's housing unstable, if they had a stable home, what would be the avoidable costs? And we conservatively put that number at $111 billion over 10 years. So when people say we don't have the money to do it, I say we're spending it now and getting bad outcomes. Why don't we spend it better and get better outcomes?
Thanks, Megan. You can applause for that.
Yeah,
Yeah, and this, the topic of controlling escalating healthcare costs is something that is a national conversation. It's certainly come up in every single presidential debate, and so we have to make sure that housing is linked to that conversation. So let's, I'm going to go back to Irma, and let's talk about the presidential candidates, how they've articulated detailed plans to tackle housing instability and homelessness at scale. I think nearly every presidential candidate has articulated a plan. Not coincidentally, there are several former mayors in the field, at least were. I don't know how many there are left, but certainly when it was the big field, there were a lot of mayors in there. Why should this issue be prioritized at the federal level? And what do you think's going on there?
So my job at the National League of Cities, my day job is to be the chief lobbyist on behalf of our members on Capitol Hill and with the administration. But my other duties as assigned is to run our big campaigns, raising awareness about issues most important to our city leaders. A couple of months ago, we pulled together a group of city leaders, about 40 city leaders from across the country, representative of large cities, small cities. Mayor Garcetti from Los Angeles, Mayor Suarez from Miami, Florida, were the co-chairs. And we wanted to bring together this group because we wanted to take advantage of the opportunity that the 2020 cycle was going to present, to raise the profile of issues most important to local leaders. And I want to say there's been we've talked a lot about homeless and the homeless issue and the working poor and affordability, but the reality is, and what we've seen also, and I've heard from my members, is housing is an issue that two-income households are struggling with. And so when we brought together this group, we asked them, what keeps you up at night? And I will tell you the issue of housing was either in their top 2 issues. And then we looked at what is keeping up Americans across this country at night. Housing was in the top 2 issues. And so we came away with housing instability and the issue of homelessness being the top 4 priorities, or being listed in the top 4 priorities for our 2020 Leading Together agenda, which is our city's agenda, which we have contacted every presidential candidate on both sides of the aisle who are running for president, asking them to adopt these issues. We developed an issue brief. If you want to learn more, you can go to citiesagenda.nlc.org to pull it up. But we developed an issue brief to talk about the issue of homelessness and housing. And what we're doing is we're asking every candidate to commit to taking action in the first 100 days. And so what we are doing is we are asking all of our members from across the country to say to all of the presidential candidates that are contacting them asking for their endorsement, sure, I'd be happy to endorse you, but let's talk about this issue of housing and what are you going to do to take action in the first 100 days? Let's use our power to make it a priority. Because I don't know about you, but I've watched umpteen debates that we've had on the national stage, and I feel like they're talking about the same things, but they're not talking about what matters most to Americans every day. And as a result, people are tuning out.
That's right.
So what I've said to candidates and what we're saying is, let me help you out. This is what they care about, and this is what it looks like. All I need you to do is have your team adopt this into your talking points, your messaging platform, and say you're going to take action on the first 100 days. So that's what we're doing. We're excited about doing, and we look forward to working with our coalition partners. Also, we as an organization are leveraging the work that we're doing. We're doing work as it relates to healthy housing initiatives. Cities themselves, even though we are demanding that the president and the Congress take action on the issue of housing and right away, like yesterday, cities aren't waiting for them to take action. You have cities that are creating affordable housing units in communities that are gentrifying. You have cities like Portland, Oregon, who are partnering with local health organizations to basically provide supports for people who have high medical needs. You have cities like in Bozeman, Montana, who are passing ordinances so that there can be duplexes in certain neighborhoods where they didn't exist before, so that people who work every day, and Bozeman, let me say, is a low unemployment place, and so, but people there that are working are being forced out of those communities, and so the city itself is taking action. So what we want to do, and what we've done through our homebound report that we released last year, is to identify what are the solutions that are working at the local level. We're pushing our members to adopt those, but we're also saying to our federal partners, hey, this is what's working in the states. And even though we've had Democrats and Republicans who have both introduced housing-related bills, the issue isn't just zoning and regulatory work that cities are doing. Like, we're not the main reason. Although we are owning our part in it, there has to be a partnership, and we can't let people absolve their responsibility of helping to address this.
Thank you, Irma. So I want to make sure we stay good on time. So we'll move into the rapid fire, not rapid fire, but a little bit quicker. Fatima, I wanted to highlight a recent report series that the National Women's Law Center put out called Tax Justice is Gender Justice. In that report, you highlighted some connections between tax policy and housing, and I'm hoping you can talk a little bit about why equitable tax policy is central to fair and affordable housing.
Yeah, and I hope people go to our website at nwlc.org and read the long version, since I know this is supposed to be rapid fire, but I'll just say a few things. The first is that what we know is that the tax code doesn't actually work for most of us, and the way in which it treats housing is a really important example, and so it connects to this conversation really deeply. So the tax subsidies that are in the code around for home ownership, like the mortgage interest deduction, that's really something that is geared for higher income families. If you're taking that deduction, you usually have a higher income. And it turns out when you run the numbers that it is higher income and mostly white people who take that deduction and who can afford to buy homes. So, when we're thinking, at the Law Center, when we're thinking about in doing our own policy mapping, starting with women of color, starting with low-income women, it raises a real question about what is in the tax code that is serving them. And so the reports really outline a range of ways we've sort of left out or not used the tax code to uplift. And then also the result of that, the result of having a tax code that is so skewed in the way that it is to support the wealthy, is you also have a situation where you don't have as many revenues as you should be having coming out of our tax system. And then what you have is this overarching debate where, who is it that said we never have enough money? Right. So, I mean, right after they passed the tax bill, within a week, there were deep complaints about all the cuts that needed to urgently be made to programs because there was no money. And I was like, they just last week did this and nobody is connecting it. And so you can expect that to happen for sure. Here's the last thing that I'm going to say, because I know we're out of time, we're short on time, and that is, it is about the tax code and it is about constrained budgets, but it goes back to some of our earlier conversations, and you're going to think I'm from everywhere. But in truth, my family now lives in Detroit. And there is another article that came out this week that reminded me of, you know, there are some times where you can urgently use the tax code to provide relief for people. And after the Great Recession, Detroit really never recovered in a meaningful way. And there was this article that was really, truly disturbing about how coming out of the bankruptcy, you have all of these people who are still saddled with tax bills at a local level that do not actually reflect the current or even the past housing value of where they are. And so you have all of these people who are on the cusp, right, of barely holding on and potentially losing their, and becoming yet another person who has had a major, major loss. And so if you start your policy work and your agenda from using these tools to support low-income families, using these tools to put, for us, to put brown and black women at the center, then you have very, very different outcomes. And that is why we're thinking of these two things together. But I encourage you to go read all 3 reports on our website.
Thank you. Okay, so last question. I'm going to leave it open for both Sister Donna and Megan to respond. But you know, this campaign is all about increasing federal investments in housing that's affordable to the lowest income people. It's a policy advocacy campaign, and we're trying to bring non-housing groups into the mix. And so sometimes that can be difficult, right? Organizations from maybe the faith-based sector or the healthcare sector will say, well, you know, we don't do housing policy. What would you say to them about why they need to be involved in this conversation?
Well, I think I would revert back to what I said earlier, that for us, we've been involved in housing for 110 years. Yeah. But it was housing immigrants that were coming to the country 110 years ago. It's shifted now to a far more critical situation. We don't have a choice about advocacy. Our folks are on the Hill, both in our state legislatures and here in Washington, really trying to advocate for those kinds of bills and policies that will move this situation forward. We don't have a choice. One of the interesting things that I think that is really come to my attention is that 2 years ago I was at the Catholic Health Association Board of Trustees meeting, and it was their board retreat, and they're saying, well, what's the next big thing that we need to get into as Catholic health? And so people start talking about, well, care for the mentally ill and low-income housing, affordable housing, food security, et cetera, et cetera. And finally, one of the board members raises his hand, who's the head of a big system, and he says, we're really siloed. Because we're sitting here with the president of Catholic Charities USA that does all this stuff. And how come we have to reinvent it? And so right now, to try to look at how we even tailor our advocacy efforts with healthcare and the social service agencies, because we know that these housing initiatives are not going to be successful if we don't deal with the social determinants of health. They will flop, and they'll turn back into the god-awful projects. We need to have the social services around them. So it's like getting rid of the silos and saying, get our act together, both in terms of advocacy and practice, and start thinking outside the box.
Yeah, I'll just say that for healthcare, we can't afford not to be in this debate, right? Like, one would argue that we house people right now. We house them on inpatient wards and in emergency departments, and they're very expensive. And so, to an extent, as we shift from thinking about housing as perhaps part of our charity, part of work, it really is going to become more and more our business model. We need to more realistically think about ways in which to partner with the housing sector so that we can create not only healthier patients, but healthier communities. And so that I truly believe this will not feel weird soon, that hospitals will regularly devote parts of their investment portfolios towards investing in social impact, because we know that that has a return for our patients short-term and long-term. You're going to see us showing up around policy debates because we know we're not going to solve housing on our own. We're expensive enough already. Can you imagine us doing housing? We need to be able to partner with the right community to make that happen. And I think that we have to be able to talk about this in racial terms. The reason that's important is that we talk now not just about equality, but about equity. And more, we have to be able to acknowledge that patients, when we talk about homelessness and the fact that 8% of the population is Black and 40% of the homeless population is Black, we have to be able to talk about that we have created the problem and we need to be part of the solution. And so more and more, this is about, are there ways in which we can improve people's lifespans by actually impacting where they live? And that should be as much part of healthcare as any pill or any technology.
Thank you, Megan.
Thanks.
This will not feel weird soon. I like that. I love that. And we've certainly seen that with the campaign over the past couple years as we approach organizations in the anti-hunger sector or the criminal justice sector. There is certainly a growing recognition that, as Sister Donna said, we don't have a choice. Housing is so inextricably tied to outcomes in all these other areas, there really is no choice but to advocate for better policies. So with that, we're going to close. If we can give a round of applause to our wonderful panel. I want to thank them for a great conversation, and thank you for everybody who took time out of your busy schedule today. We're going to have a recording of this event, so if there are folks that couldn't make it for whatever reason, there'll be a recording. We'll send that out soon. We have materials out on the back table. If you missed that coming in, please try to pick up those on the way out. And yeah, as you heard today, whether you're healthcare, whether you're education, whether you're gender equity or faith-based, we are all, in a sense, housing advocates. So thank you all for coming.